Welcome to Fundile Talk. I hope today you enjoy. Today I'm talking about a critical condition that has affected most women worldwide. I'm talking about cervical cancer. But please remember to subscribe, comment, and like. Don't forget that. So today we are talking about cervical cancer. Cervical cancer is the fourth cause of death worldwide. It has affected most women, and some they die at the late stage without knowing that they are affected by cervical cancer. What is this cervical cancer? Cervical cancer is it's whereby we're having pre-cancer cells that affect the cervix, and those pre-cancer cells, they start becoming abnormal and they start eating the cervix bit by bit. It can take 20 years. You can have children, but you'll be having cervical cancer, and it moves with slow progression up to maybe 20 years, where you discover that your cervix is already ruined. And it is asymptomatic. There are no symptoms. So therefore, we just want to urge every woman in the world to know your cervix. You have to know. Now what we are doing, we are using a visual whereby we view your cervix through a speculum. Then we insert aesthetic so that if there are pre-cancer lesions, they can be viewed in the visual, in the screen, so that we are able to identify those pre-lesion using acetic acid. That acetic acid is just inserted, maybe put for 3 minutes. So we are saying we are now in advanced stage whereby we use a visual technique to visualize your cervix. After I finish teaching you, after you take a picture, a nurse takes a picture, he will show you a visualized your cervix, so that you see whether your cervix is healthy or you have pre-cancer lesions. These pre-cancer lesions, it helps when these pre-cancer lesions they are starting. It will help us to eradicate, to remove those pre-cancer lesions before they metastasize, before they spread to all other body organs in the body. So now I just want to show you a normal cervix. You see, these are two cervix. The top one, it's a normal cervix of a woman who have not delivered birth through vaginal, or it's a cervix for a woman who have never had any baby, or it's a cervix for a person who have delivered through cesarean section. The baby did not, it's intact, as you see. It's a clean cervix, and there is no pre-cancer lesion. Sometimes you find clients coming and saying, I have no baby, I have never given birth. When we visualize the cervix, you discover that something was tempered. Maybe the person had once had an abortion. It's just simple. It shows that something with the baby just went through this cervix. So this one, it's intact, no baby who went through that cervix. It's clean, no pre-cancer lesion. Then if you look at the second cervix, here it's a clean cervix with no pre-cancer lesions, but this one is for a woman who have delivered the baby through vagina. That's why the opening, if you look at the different clothing, the opening, this one is open, this one is just it's just intact. So these ones, they are good. There are no pre-cancer lesions. Then, what these pre-cancer lesions which I'm talking about? Look at the this second one. You see this white. These are pre-cancer lesions that I'm talking about. I'm not saying you have cancer, but you have got precancer cells that have invaded your cervix. So these ones, they have covered more than 75% of your cervix. Therefore, now what we have to do, if it's like this, we are supposed to do lip. Lip is done by the doctor, whereby they does remove. It's a minor operation. We do the operation while we are talking about with you. You just feel like you are in menses, but it's just an extraction where the doctor uses a specialized blade to remove these precancer lesions. Then after removal, you have a wound. Then this wound, we are saying you abstain from sexual intercourse for 6 weeks so that the healing process take place. I'll explain why these 6 weeks. Then this other one, you see that the precancer lesions has invaded a wider range. It's more than 75. Now it's 100%. Now the cervix, now on this stage, we don't know whether it has invaded the inner part, even to the uterus or to the other parts of the areas. Then here we have to take a biopsy. Then we send this biopsy to laboratory so that they investigate how this if this is a precancer cells have invaded other parts of the body, like the uterus, the stomach, any other organs within the body. Then if the result, it says it's within the cervix, then the cervix, it has to be removed before it metastasizes to other parts of the body. So in this area, there is no option whether you haven't have a child. You want to save you as a mother. You want to save your life. A removal of the cervix, it doesn't take much time. If we do the scan and we discover that in your uterus there is no fibros, nothing, the cervix is just removed below your vagina. Your cervix, if you put your fist, is just the size of a fist, or size of your hand. Your fist is just the size, so we remove it below. Then during the day, you go home. But if you have got any other problems like fibroids, then we remove it through cesarean section on top, because it's depending on the size of the fibroids that you are having. Then the last one is whereby we discover that now the cervix, the precancer lesions are everywhere. Now what brings the patient to the hospital is because the client is bleeding. I told you there are no symptoms on this. You are now bleeding. Maybe the client is 84 years, 85 years, is no longer is on menopause, is not on menses, but you discover that the patient is bleeding. Or sometimes when we are bathing, you discover there are smelly meat coming out. It's where most of the clients come to hospital, but it will be already bad to the extent that the cervical cancer will be like this. Now you can't even see the opening. The cancer is eaten the cervix. As you see these pictures here, it has eaten everything. So it's pathetic when somebody gets to this stage, because now you are supposed to, we can't even remove the cervix, because it in this stage it has invade other areas. So now what we are left, the option is to give you opioids so that you don't feel the pain. Maybe the other option is chemotherapy, radiotherapy. Those are the few options that are left. So it's pathetic for me to meet such clients at an advanced stage where we are failing to give you treatment. That's why I'm saying every woman with a cervix should be screened early, so that we run away from the late stage, where now we'll be crying with no little help. It's important. What causes this cervical cancer? We are saying most of the people, when they are early sexual debut, it's one of the leading cause. You might find yourself we are having 5 children, but you started sexual intercourse when you were young, younger than 16 years. We are saying it is a predisposing factor, because as God created a human being, it did not create somebody to indulge in sexual intercourse at a tender age. Because why? There should be a lubrication that should be there during sexual intercourse. So when you look at the under 16s, that lubrication is not yet there. It means when they are indulging in sexual intercourse, we are living with that child with the sores, and those cells, they are the ones which predispose, because cancer cells, they live in the surface of the skin, in the epithelial cells. So these epithelial cells, you find them in the vagina, anal region, in the cervix. So where there is tear, this is caused by human papillomavirus, and this human papillomavirus, you will discover that it is dormant in the vagina with no harm. But once there is tear, there is a wound, it takes chances to get in through that wound until it reaches to the cervix. So we are saying, if children, they abstain from sexual intercourse until they are mature,
you are supposed
enough
to play
until there is, so that you have lubrication, so that if the man enters your vagina, there is a slippery flow of lubrication, so that you don't have tears, and it doesn't predispose you to this cancer. It's very important. Communication is very vital. So some women, what I've discovered in our African culture, it's very difficult to talk about sex. To tell your husband about sex, it's very difficult. So they just keep quiet in the name of marriage. But we just want to advise, if male partners, to also play a role. Try to romance. It has to be 50-50, so that even the sex is enjoyable when there is lubrication. And also, one of causes, it can be due to, if you contract a sexual transmitted infection, please go to the nearest clinic to get medication as early as you can, because some of the sexual transmitted infections, you have sores, warts in the vagina, and those, they predispose to cervical cancer. So please try to get medication as fast as you can. And others, women, they use African medicines to put inside the vagina, so that they try to contract the vagina, so that when the man enters them, it's tight. That also predisposed to cervical cancer, because as the man enters where it's dry, it predisposes you to tears and what. So what are we saying, women? Should you make men to enjoy that, while it risks your life? Sometimes I'm talking to a woman with 6 children, 8 children, then you die of cervical cancer because of that. No. So we're saying, do not use anything. Do not use African medicines to put inside your vagina. God created it like that. Lubrication should be there. It should be enjoyable. It's good. So please do not. And also, I encourage women, sometimes you'll be having long nails, and you clean inside your vagina. And sometimes some women, they touch even the cervix. Cervix is very soft, it's delicate, to extent that sometimes you get tears to the cervical, and you won't be knowing that you are bleeding inside, and that predisposes you to cervical cancer. And I also urge that if vagina is an acidic environment and it is the cleanest in the body, if we are comparing everywhere, it's the cleanest area anyone could have, it's acidic. So what we are saying is, it's acidic if you clean inside. You are not supposed to clean inside, put your fingers inside. Cervix, it has got its own way of cleaning itself every month. It just cleans. So if we are cleaning, putting soap inside, you are changing the temperature of the acidic environment and it becomes alkaline. And when it becomes alkaline, now we are predisposed to infections. Sometimes those infections, they may mistakenly say it's sexual transmitted infections because you'll be having discharge, false milk discharge, but you are the one who is introducing the infection through use of your fingers inside. And this is a problem in most of the household where partners, they fight, because sometimes at hospital clinics they will tell you that you are having sexual transmitted infection, and now if it's like that, the husband should come for treatment also. But in the contest, it will be not the sexual transmitted infection, it will be the infection introduced by you using your fingers inside. And also during sexual intercourse, it enables women to be cold. The man doesn't feel you that you are a woman, you're supposed to be hot, because you have changed the pH of the vagina. So it's very important to maintain that. And I urge women, even during the day when you want to sleep, you want to bath, especially when at 4, at 5 for the night, you're supposed to bath at 4, 5. Then you look for a clean cloth. Then you put just a clean cloth without tampering with the inside, so that you stay warm. You maintain that warmth. Not to bath and to just go to bed. You'll be cold. So I urge that. And also I encourage women to, in terms of hygiene. Hygiene is very, very important, because the vagina and the anus is too close to each other, too close. In a sense that a woman you have to defecate in the morning. When you wake up in the morning, you don't just defecate at 1, at 4. No, a woman should be disciplined. So if we are used to 2 to 1 today, after seeing this video, you are supposed to change the things how you do. You are supposed to drink a glass of water in the morning. It's very good. It's very, so that you remove all the dirty, the food you ate yesterday, and start a day with a clean stomach. So after 10 minutes after taking a glass of water, you feel the urge to defecate, then you defecate. After that, I'm expecting a woman to clean yourself, even if you did not bath the full body, but you take water, you clean the vagina, you clean the anus. So that sometimes some of the women, they don't know how to clean after defecation. You don't know how to hold the tissue. You don't know, sometimes you find fixes entering the vagina. I have seen it. So I'm teaching about it because I have a concern on that. You take your tissue, you hold it. If I'm right-handed, I'll use the left hand. Then you start bottom up, so that you don't insert anything in the vagina. It's very, very important. Then you clean your vagina after defecating. You clean your anal region, so that if you didn't clean up with the tissue nicely, I know bathing, it will do proper work, so that we avoid urinary tract infections like cystitis. So it's very good to be hygienic, and it's also good in our homes. Let's say you now want to go and sleep with somebody is going for defecation and it doesn't bath. It turns somebody off. So it's very important. We can even teach our children to do that before they go to school, because some of the schools' toilets are dirty, children are young. So let's do that, and to keep our bodies clean. And also, those are the risky, and also we are saying stay one partner for life. Have one partner for life. Don't change partners like you are changing, I don't know, cars or what. You have one partner for life so that we reduce the risk of cervical cancer. And we are urging even men to be circumcised. Circumcision is the best, because also the HPV, you can find it in the shaft of the penis and around the fold of the skin. So it is important for men to be circumcised so that they reduce the risk of cervical cancer to women. So I just want to urge all men to be smart if we can. And it doesn't only protect the cervical cancer, it also enables the men during sexual intercourse to go. The topic is too long. I will continue next time. Stay tuned. Remember to subscribe, like, and comment, and I'll continue on the treatment measures next time you see me. Please help me to reach 200 subscribers. Please subscribe. Thank you.